Our firstborn Zeke was not even 1 when we first moved to Angola. And then the next time we came back, Zeke was just turned 4, and Eliel was 1.5, and Naomi was still several months old. So they've grown up here, and so coming back here was coming back home when we returned.
The reason why we're here is because we feel like God, that Jesus has given us a chance to love others, and that He has shown us that He loved others, and that He loves us, and He calls us to love others in so many different places. And for us, it's here in Kalukembe. When we first came to Angola, someone was telling us about all of the people who had come and gone, now all of the missionaries, and how only the strong stay in Angola. And he was saying it as an encouragement, and we left the house thinking, yeah, yes, we feel really strong. And then slowly over the next few hours as we went home wondering, are we really strong enough to stay? Because we were having a really hard time. And then realizing, no, I mean, we really respect our friend and a fellow missionary, but we disagree with you. We're not here because we're strong enough. We're not here because we'll be able to do this task. We're just part of this bigger, bigger task, of this bigger work. But I think that's what God calls us all to do, wherever it is, whether it's in Philly or here.
Intermittent electricity, intermittent water, or no water. It was a difficult time for the country as a whole when we came, and especially for the church here. There had been a number of upheavals before we came into the hospital, and so it was a bit of an adjustment coming into some strained relationships, as well as lack of resources, lack of medicines and materials.
So we see a lot of death here, moms, babies, kids, men, women. So even though the war isn't, like the civil war is done, this is still in some ways like a battlefront. So I think in some ways we have the mentality of soldiers on the front lines. You just kind of move on from one lady to see what you can do for the next patient.
What I would like to see in the hospital or in the community, some lives affected in a way where they will go from the fatalism of life and that's just the way it is, to being activists, and to be going from just living life like a refugee to living life like there is a purpose, and there is a greater purpose for all of us.
It's a beautiful place. We have so many amazing colleagues and amazing stories. It was so much fun being on the women's ward on Monday, seeing all of these women celebrating their successful surgeries. And it turns out that we weren't necessarily praying for Kalukembe, but when we came here in 2012, when we were talking about coming back here permanently, the director of inpatient was telling us about how they had been praying for the last 20 years every morning at 7:30 for more doctors to come back to the hospital, because it had been 20 years since any doctors had been permanently here at the hospital. And so in some ways it's like God had prepared the work for us to do, and we were just people willing to come and do that work.
I really do feel like I have a purpose of being here and testifying to what God is doing in Kalukembe and how God is blessing this community. Not always, there's moments where it's really dark and hard and difficult, but there are some moments, whether it's just a nurse who is really investing in the care of a stranger, to even something a little more bigger picture, like last week when a man accompanied his wife, who I've been seeing for the last couple years, who has suffered pretty bad consequences of a stroke, but has $1 million smile still. And her husband said, you know, I notice you're here still, and you must be here for the patients. So those kinds of things are always uplifting.
We love being able to work with our colleagues and our brothers and sisters here. There is so much work. There's so much work. And work is good. Work is good. I'm so glad that I get to work. That I have a body that's still healthy enough to work. And a mind that's able to let me work.
I think one of the biggest blessings is just that we can be, as a family, living in a community and getting to know our neighbors and being neighbors to our community has been a huge blessing for us. And I think that it's been a blessing, just that process. So as difficult as it has been at times, it's also a blessing that comes with a lot of joy for us. So I think it's just realizing, you know, the biggest thing that's happening for medical rookies is just the work of God in their own lives. And is it to be worked on, to be seeing how your soul can change? Or is it all about these other things of how well you're accomplishing your medical work, how well you're doing your evangelism perhaps? I don't know what all the priorities may be. But my advice would be just be patient. Be patient and see what God's work will be doing in your life. So it's really the care of your soul. That's the biggest thing, and I think that would really be the trajectory of how or where you would be going or what you would be doing.
It's an extraordinary place that we are at, but I don't think our lives, that we're living an extraordinary life. I think we're just doing the work that God has prepared for us in advance to do.
The moments where I felt most inadequate are actually the best moments for putting me back on my knees, because as a believer in a God who again cares for this universe and for all of us and cared so much that he died for us, it just reminds me freshly again. It's like, you know what? I've been forgiven. I've been healed and I've been made whole. And as much as I am frustrated that I'm in a broken situation or I'm dealing with other broken people, that I can be a part, I need to be here to be a part of the process of making things whole and renewing things. And I want to be a part of that.
We are here to love people, but also we are here and we continue being here, not because I think out of our strength, but knowing that God is walking with us and that, yeah.